What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video, we're covering the Truman Smith kids. Basically, for those who do not have Truman Smith, those are special patients who are usually younger-ish range, who come with, they'll either be contracted, they'll have like a trach, they're very high needs as far as like medical wise type patient. Usually they're not verbal. Occasionally you'll have a few that are verbal and kind of understand, but majority of the times they're not. I've only seen like one or two that are more, I would say, like they understand you type stuff. Usually with those, majority of the time we just do chest x-rays on them. Occasionally we do KUVs on them. Those, depending on what we're doing, you may have to hold, because majority of the time they'll be contracted, they won't be straight, and their lungs aren't exactly, like, some of them will be like very elongated, very, like, they'll be very, like, they're not the most easiest to patient sometimes. Same thing, like sometimes you'll have to hold that to like move their hands, or sometimes they'll be contracted. Majority of the times, I guess it all depends on your radiologist. If they're contracted really bad and they won't budge, sometimes the best you can do is like semi move it, shoot it, and then semi move it again and shoot it again. The only time you'll have to make sure that it completely is out of the way is if like it's for like an NG tube or OG tube placement, because they want to see like where the tip goes. Those are the times where if the patient can't move their hands, you may have to let up and do that. Same thing with their head, especially if they have like, if you think they have a normal pneumothorax or something like that, and the patient's head like this, you have two ways. You can either use gravity and kind of like tilt the head back so like you can get a better view of their APCs, or angle the tube and you'll have to like pull the board up. That's another way you can kind of handle those situations. Or you're gonna have to let up, or have someone just kind of like move their little head back. Majority of the times, I've been told by my lady who's a nurse, most of the time, because she's worked in places, they'll send, like, if their Truman Smith patient gets any level of sick, some of them just not to deal with them, emergency room. They'll send them off a lot of times. My lady has told me that they do that a lot. Sad but true, because they want to deal with them. And I can say that I see like the 10 same patients over at least once a month. They'll come into the emergency room. Yeah, a lot of times overnight, and they will be all kinds of contract. The worst one I've seen was one who was like kyphotic, and they like can't lay on their back, so they're on their side, and they would order morning ports, so you'd have to like physically kind of like roll them, and like it's pretty bad. And like they had like extremely elongated lungs to the side, I guess because of their kyphotic, and it was, you'd be very lucky if you would get it in like one picture. So like that's one situation that you can deal with. Occasionally they may like hit their head and like more like facial, but most of the time they'll order CAT scan on that. But occasionally, because they won't hold still, sometimes they'll have you shoot. I've shot in like just the AP and lateral of a face, well, of a skull. Facial bone? No, just AP lateral skull on some of the patients. And they always have a lot going on. So, yeah, try to be careful with them. Yeah, it's been where we go. See you on the next one.